So we've done muscle names based on shape, and we saw a few of these examples. Now I can't put everything in, but there are many more examples given in your notes. So let's take a look at this question. This is a bit of a combination, so it's like not only is it on shape, but you also, we will be doing muscles based on action, but I want to see whether you can bring your skeletal system knowledge back and figure out this one. Okay. Whoa, Maximum got it right. Yes, it's a forearm muscle, a square muscle present in the forearm. Quadratus means square, and pronator is its action. Remember, pronation and supination were movements which we did in the skeletal system, which were at that radio-ulnar pivot joint. Remember, in the forearm, pronation and supination. So therefore, any muscle, if you see that there's a muscle called, it doesn't matter what the muscle is called. If it's called pronator quadratus, there's another muscle called pronator teres. Teres means round. I remember I did that earlier. There is a muscle called supinator. All of these muscles, the action in supinator is only the action, but quadratus and teres is based on action and shape as well. These muscles will be present in the forearm because that's where pronation and supination occurs. Got that? Okay. Now let's look at muscle names based on size. So, and on size, we have names where you have going from big to small. So it could be either the muscle could be called major, something major. For example, this muscle pectoralis major, and this muscle pectoralis minor. So you can see here, minor automatically tells you it's a smaller muscle, major automatically tells you it's a larger muscle, and pectoralis is location. So if you were asked where would you find pectoralis major, or how would you describe it, it's a large muscle present on the front of the chest wall, because this area of the chest wall is called the pectoral region, okay? So major and minor are one way to classify big and small. Another way is to classify using these three terms, longus, brevis, and magnus. The word magnus comes from magna, meaning huge. So magnus is a really large muscle. Longus is a muscle with a long tendon. And brevis is a shorter muscle. So here you have these three muscles which kind of follow that protocol. You have this really big muscle called adductor magnus. It's this huge muscle. It's present all the way at the back, and very, very big muscle, really big. If you remove these, you'll see a bit of the adductor magnus there. You can only see a little bit here. So this is adductor magnus. This muscle here has a long tendon. This is called adductor longus, and this little smaller one is called adductor brevis. Now this again has an action attached to it, adduction. Adductor means it causes adduction. And you can see, and this will help you in the lab, always look to see where the muscles are attached. Can you see all of these muscles are attached here to the pubic bone, and they're all going towards the femur, right? Can you see that? They're inserting on the femur. So which joint will they act on? Hip joint or knee joint? Hip joint, right? They cross the hip joint. They are going to act on the hip joint. So they will cause adduction at the hip joint. Do you understand? In order to act on the knee joint, they would have had to cross the knee joint. Whenever a muscle acts, it has to cross a joint in order to act, okay? So here they are crossing, they're going right across the hip joint here. So that's why they will act on the hip joint, okay? So these are adductors of the hip joint. Then we have another way we can classify muscles based on shape or name them. These are maximus, minimus and medius. Maximus obviously means the largest. Minimus obviously means the smallest. And medius means something intermediate. And the muscles that we have are in the gluteal region, which is the buttock area. So gluteus maximus is this huge, the largest muscle in the body. Deep to it is this second muscle, which is next in size, gluteus medius. And if I kind of cut gluteus medius here and I could peep inside, gluteus minimus lies deep to that. So it is a smaller muscle, okay? Gluteus maximus, medius and minimus. So this is fairly simple based on, you know, what names they have. So gluteus maximus would be a muscle lying, a large muscle present in the gluteal region, okay? Okay, so I did go over this. What does the name pectoralis major tell you about the muscle? Okay, glad most of you got this right. Yes, it's a large muscle, and that's why you have to know these surface anatomy terms which I told you. So look at that slide in introduction lecture that we did, the PowerPoint. The front of your chest wall is called the pectoral region, and here too, if you kind of looked at this previous slide here, see this is the front of the chest wall, pectoral region. So, you know, you say, oh, this person's pecs are well developed, okay? So you're talking about this pectoralis major really. So here it is. So it is a large muscle present over the front of the chest wall, not the shoulder area. The shoulder is here, and that's where the deltoid muscle is present. So you will see from that we don't always have muscles kind of grouped into very neat little categories, like you only location or only size. You know, you kind of always tend to, there are times when they are mixed. For example, pectoralis major was location and size. Adductor magnus was action and size, you know, so you kind of get a mix of them. Here, this is again a fairly simple one where we're looking at muscles based on their names, based on attachment. One is that we have two muscles in the body really where they have two bellies. So based on their bellies, we call them digastric, or there's another muscle called omohyoid because it's attached to the hyoid bone. So these two muscles have two bellies and they are attached by a tendon. So here's one of them. If you look here, this one is the digastric. So one part of the muscle is attached here to the mandible and the other part goes close to the styloid process. And here's the little tendon in between, so up here. And here is omohyoid. One part is attached to the hyoid bone and the other one, there's a belly, a tendon deep to it, and then the other one comes and attaches to the clavicle. So these are kind of a little bit separate. But if we leave these out, then we have muscles, and the names themselves tell you very clearly where they are attached. And usually the first part of the name is where they begin and the second part of the name is where they end. For example, sternothyroid, going from the sternum to the thyroid cartilage. Thyrohyoid, going from the thyroid cartilage to the hyoid bone. Stylohyoid, this is cut. This muscle actually comes from the styloid process. You remember there was a little styloid process to the hyoid bone. Stylohyoid. Here it is shown on this side. You can see stylohyoid on this side. Stylohyoid. Then here is a muscle called sternohyoid, from the sternum going all the way to the hyoid bone. This big muscle which is present on the side of your neck, which when both sides act, it kind of helps you to pull your face down or flex your neck. And when one side acts, it turns your head to the other side, and you can see it as I'm turning it. This muscle is called sternocleidomastoid. So two of the words you know, sterno and mastoid. That means from sternum to the mastoid process. The word cledo means clavicle. So you can see it's attached to the sternum and the clavicle, and then the two parts join and then they go up to the mastoid process. Okay, so it's called sternocleidomastoid. It could have been called sternoclavicular mastoid, but cleido is the Latin name for clavicle, so that's why it's called sternocleidomastoid. Okay. Now here's one where we talk of muscles based on how many heads of origin. What do I mean by how many heads of origin? That means how many places are they arising from. Each place they arise from is known as a head. And if you look here at this picture, so the first one is, most muscles arise from, there's one head and there's one insertion. So, we don't give it a name. We just call it based on, something else. But let's look at this muscle biceps brachii. It has two heads. Can you see two parts, two origin? One comes from the coracoid process and one comes from a tubercle on the glenoid, just above the glenoid fossa. So it's got two heads and they both then sort of fuse together to form the belly of the muscle, and then the muscle comes and gets inserted on the radius. Main insertion is on the radius. So this muscle name, when we use the word biceps, triceps or quadriceps, it is based on how many places it is arising from, and that means how many heads of origin. That's very important. So do not confuse this. Do not answer in your test or quiz that how many insertions it has. It has how many heads of origin. Okay. So triceps brachii, for example, there are three heads. So here you can see one head, here you can see another one, and deep to it, what you can't see, if I cut this part of the muscle and I kind of removed it, then actually I will see on the posterior surface of the humerus, the third head is arising. So three arise together. So in other words, if you were to look at it from the side, here's one head, here's the other head, okay, and the third head is deep like this. Can you see? And the three then join together and form a common tendon, so that's why it's called triceps. It's called brachii because it is present in the arm, and the other word for the arm is brachium. The brachium means arm. Then we have this muscle which is called quadriceps femoris. Actually, the full name is quadriceps femoris. So you can see it is lying in the thigh, because femoris means to do with the femur, the thigh. So this has four heads. Here's one head which actually arises, it comes really from up above, from the hip bone. And then here are these ones on the sides, the medial and lateral side. So there are three heads. And again, if I was to remove this head, I can see a fourth head deep to it. So there are four areas of origin that it comes from. Three of them are from the femur and one is from the hip bone. So it's called quadriceps. And you can see all of them then fuse together to form a common tendon which comes down to the tibia. Okay? So what would you say about the biceps femoris? Okay. The correct answer is has two heads of origin as found in the thigh. Now here's where you should not forget your skeletal system. Remember, the femoris is femur, has to do with femur, and femur is the thigh bone. Okay. arm, it would be humerus, and the other word for the arm was brachii. That's why we had biceps brachii, which I wrote in this slide here. So here, biceps brachii, which is here in the arm. Here, this is femoris. This is called quadriceps femoris because it's got 4 heads, but there's a biceps femoris which is seen on the posterior aspect of the femur. And that's how you can't forget, you can't afford to forget your skeletal system knowledge. You must know. So these are hints that the name gives you. Femoris means to do with femur, which is a thigh bone. Okay? If it was leg, it would be, remember the bones of the leg are tibia and fibula. So it would be called tibialis something or fibularis something. Okay? So remember that in anatomy, when you look at this is the thigh, this is the knee, and this is the leg, and then this is the foot. Okay? Rather awkward looking, but you get the picture, right? Okay? So you can't call the whole lower limb the leg. Okay, here's another one where we look at muscle fibers their names based on direction of muscle fibers. So if the direction is going up straight, the word for straight, we use the word rectus. So you can see this muscle, rectus abdominis. So this tells you that this is a muscle which lies in the abdomen and its fibers are running vertically upwards in a straight manner. So you can see they're going straight up. Okay? Then we have muscle fibers, muscles present in the abdomen itself, external oblique. So here these fibers are running obliquely. So you can see these fibers are coming obliquely down like this. And as I said earlier, I seem to remember telling you this muscle is actually called external obliquus abdominis, to tell you that it's a muscle present in the abdomen whose fibers are running obliquely, and it is an external most muscle. It's the outermost muscle. That's why we're calling it external. Inner to this is a muscle called internal oblique, obliquus abdominis. It is lying internally. That means it's not the outermost muscle. Its fibers run obliquely and it's present in the abdomen. And then we have another muscle which is deep to them, is called transversus abdominis. So you can see the fibers are running transversely. So notice how these fibers are running transversely. These are oblique, or they are this way. So they are oblique. And from this picture itself, you can see how the fibers kind of are in different directions. So this also adds strength to the anterior abdominal wall. Remember I told you the anterior abdominal wall had these aponeuroses where all these muscles, their tendons became flattened and they were very large, these aponeuroses, so that, you kind of protect the anterior abdominal wall. Okay? Another thing you will notice here is this rectus abdominis. Look at this. It's one long muscle, but it kind of gets divided into a few pieces by bits of these little tendinous portions. These are known as tendinous intersections. So what do you think would be the advantage of having these tendinous intersections? Pardon? Stabilization. Okay. Yeah. Strength. Yes, very good. Remember, short muscles were more powerful than long muscles. So if this was one really long muscle, imagine if you didn't have this, a very, very long muscle, its range of motion would be more, but it wouldn't be very powerful. But now you've got the rectus almost as if it's made up of 4 muscles. Can you see that? And each one can act. It's short, so each one becomes very powerful. So it adds to the power or strength of the muscle. Okay? Now, the reason these tendinous intersections are present is developmental. I mean, this is just for interest's sake. When the rectus was developing, it actually developed from blocks of muscle tissue called mesoderm. And each block then kind of fused, and where they fused, you got a tendinous intersection present, and that's how it became that whole one big muscle. Okay. I remember mentioning a muscle called serratus anterior, which was tooth-like. Remember when we were talking about shape? And here you can see serratus anterior. And look at this. It looks tooth-like. Can you see the serrated edge? So it looks like the teeth of a comb or serrated. So that's why it's called serratus anterior. Now this is just to do with 2 muscles based on structure of a muscle. We have a muscle which is part of a group of muscles called hamstrings. So the hamstrings are a group of muscles which are present on the back of your thigh and knee. Of this, one of the muscles is called semitendinosus. It has a long tendon which seems to be a tightly stretched band. So the word tendinosus comes from that. And then deep to it, we have another muscle which is called semimembranosus, which kind of seems to say that it's like a broad membrane or something like a skin. The tendon is something like a membrane. So that's how they get their name. So this is only to do with two muscles. And here you can see this muscle biceps femoris. Remember I asked you a question on that. Where would you find it? You can see biceps femoris, which is part of the hamstring group. And here it is present in relation to the thigh because it arises from the femur. One of its parts arises from the femur. Now here's one combination where either you can have a muscle whose name is based only on action, or you might have maybe based on action and what side it is lying, or maybe action and size, for example, adductor magnus that we did, okay? Or it may be also based on which joint the muscle is acting. So let's look at some names here and kind of try to figure them out. So first thing that I want you to know is that, like I said, the arm is called the brachium, the front of the chest was pectoral, the buttock area was called gluteal. The thumb, the anatomical name for the thumb is pollex, and the anatomical name for the big toe is hallux. So whenever a muscle goes to the thumb or the big toe, we call it pollicis or hallucis. Those are the adjectives we use for them. Also, I want to show you here, look at this muscle, pronator quadratus. So this is this square muscle which is lying deep to all these muscles which are present here. So this is that square pronator quadratus. Notice here supinator also. Can you see they're both lying in the forearm? Because that's where pronation and supination takes place. So let's look at some names based on action, side or joint. So let's look at this one, flexor pollicis longus. So this muscle it tells you it's a flexor, that's its action, that's why it's got flexor. Pollicis, that means it's going to the thumb, so it will flex the thumb. And longus, it has a long tendon, okay? So here you can see this flexor pollicis longus, which is going all the way to the thumb. Since this muscle, notice this muscle is crossing the wrist also and then going to the thumb. So any muscle which crosses a joint, it will act on the joint. So if it crosses 5 joints, remember I told you it will act on all 5. So since this muscle is crossing the wrist and the thumb, I mean, though the part of the wrist is not mentioned in its name, but you can understand that not only will it flex the thumb, but since it's crossing in front of the wrist joint, it will also flex the wrist joint, okay? So when we do muscle actions, I'll kind of repeat this, there are certain principles. Let's look at this muscle. It's called flexor carpi ulnaris. So it's a flexor because it's got the word flexor with it. Carpi, the word carpus means wrist. Carpus comes from the wrist. So that means it's a flexor of the wrist and it is lying on the ulnar side. So that's why it's called ulnaris. So it's on the medial side. So can you see this? Flexor carpi ulnaris. Sorry, on the medial side here. Flexor carpi ulnaris. Lying, crossing the wrist joint, flexing it, lying on the ulnar side. And if you remember, this will help you with the lab, not so much for the lecture. But if you remember, when we did the wrist joint, if you remember in the wrist joint, you can flex your wrist, you can extend your wrist, right? You can also turn the wrist medially, which was called adduction or ulnar deviation, or you can take it laterally, which was called abduction or radial deviation. So any muscle which is attached on the medial side, not only will it pull and cause flexion, but it will also cause the hand to move medially. So it will cause the hand to move medially like this. So flexor carpi ulnaris will also cause ulnar deviation or adduction. And its opposite, which is flexor carpi radialis, which has been shown here, which is cut. It's a flexor of the wrist, but present on the radial side or lateral side. So this will also cause flexion, but it will cause the hand to move laterally, which means it will cause it to radially deviate, or abduction. Okay. Let's look at some other names. Flexor digitorum superficialis. Flexor digitorum means the digits, your fingers here, because this is showing you the hand, and superficialis. So it's a flexor of the digits, but it's lying superficially. Here's another muscle which is actually on the opposite side. So these muscles, notice one thing on the anterior aspect of the forearm. So just exclude this extensor carpi because, you know, the hand has been twisted a little bit, the forearm, that's why you're seeing this. But otherwise, on this anterior aspect of the forearm, the muscles that you see, if you notice, have the word flexor attached to it. Okay, can you see that? So because these muscles are crossing in front of the wrist joint. So this itself tells you that muscles which lie in the anterior aspect of the forearm or the hand or the arm, these are flexors. And compare this to muscles lying on the posterior aspect of the forearm. Can you see this? These muscles are called extensors. Can you see everywhere there is the word extensor here? So look at this muscle, extensor indicis. See, it is going towards the index finger. So it's going to extend the index finger. But it's also going to help to extend the wrist because it's crossing the wrist joint. Extensor pollicis brevis. That means this is extending the thumb, but it's a small muscle. Brevis means small. Extensor pollicis longus. Again, extending the thumb, all the joints of the thumb, but it is a longer tendon. Okay, extending the thumb would be like this. Abductor pollicis longus. That means it causes abduction of the thumb. This movement is abduction. When you take the thumb and form like an L like this, you know, that's abduction. And here, for some reason I skipped. Okay. So this is, as you can see, on the front, on the anterior aspect, you have the flexors. On the posterior aspect, you have the extensors. And this is for the upper limb. When we do some principles of muscle action, we'll see that it changes a little bit when we come to the lower limb. So now look at this. Suppose we have a muscle called levator scapulae. What do you think that will do? Levator. What does the word levator mean to you? Very good. Yes, elevation of the scapula. Excellent. Okay. Now how about this? Which of the following would apply to a muscle called depressor anguli oris? It would be all of the above, okay? Because it would be a muscle seen on, if it has to depress the angle of the mouth, it would be seen on the face, and it would act on the angle of the mouth, and it's called depressor, so it would depress it, okay? So all three statements apply to this muscle. How about this one? The flexor hallucis would be a muscle would flex the big toe. Yes, not the wrist. Wrist was carpus. Hallucis was with hallux or big toe. Okay, how about the supinator? So let me see if you all remembered what I told you. Where would you see this muscle? Supinator. And I showed you a slide too. In the forearm, yes, not in the thigh or leg, because pronation and supination occurs at the radio-ulnar joints of the forearm. Okay, so here let's look at some principles of muscle action and try and understand this well, because this will really help you with the lab. First of all, a muscle has to cross a joint in order to act on it, and however many joints it will cross, it will act on those joints. Okay? So that's one very important thing to remember. It has to cross the joint in order to act on it, and however many joints it crosses, it will act on all of them. And you might sometimes think, oh, it's not lying directly on top of the joint, like we saw those adductors, that picture of the adductors. If I can just go back and pull that up. So if you look here, these muscles are not, if you might think, oh, they don't lie directly on top of the joint, but you see when I say cross the joint, you can understand that when they pull, they will cause here the action to occur here. Can you see when you do a stand at attention, when the femur moves close to it? So it's at this joint that the movement is going to occur, because they're going to pull the femur, and when they pull on the femur, where is it going to act? Here at the hip joint. So see, that's what is meant by the crossing the joint. Most of them cross kind of directly over a joint, but otherwise, even if they don't, you can see when they pull a bone, you can see it's going to act at a joint. Okay? So when muscles cross a joint, they will act on the joint. And however many joints they cross, they will act on all those joints. Now, from a skeletal system, remember we talked about the movements, and we said flexion was a movement where there was a decrease when two bones approached each other and the angle between the bones decreased, or when two ventral surfaces approach each other. Because, for example, when you do flexion of the elbow, that's very obvious. The forearm comes closer to the arm and the angle decreases. But when you do flexion of the shoulder, for example, when you take in the case of the shoulder, so when you're doing flexion of the shoulder here, and you take the humerus across the body this way, so you take the humerus across the body this way, there is no decrease in angle as much as there is the ventral surfaces are coming close to each other. So that's the other definition of flexion. One principle, for most of the body, any muscle which crosses in front of a joint or anterior to a joint will cause flexion. So those muscles are known as flexors, and you saw that anterior aspect of the forearm. Did you see that they were called flexors? Those which cause posterior to the muscle to the joint will cause extension, and so they are known as extensors. So you saw how muscles which were lying on the posterior aspect or back of the forearm, which were crossing the wrist joint posteriorly, they all had the name extensor attached to it, or most of them did. And the ones which crossed in front had the name flexor attached to it. And in the case of the elbow joint, for example, the biceps crosses in front of the elbow joint, but it doesn't have flexor, but you know the biceps causes flexion. The triceps crosses behind the elbow joint, so it causes extension, okay? Now, as I said, it says here for most of the body, because that means that there must be some areas in the body where this rule does not apply. It applies for most of the body. I showed you in the case of the upper limb, in front of the elbow, in front of the wrist, in front of the digits, they'll be flexors. If they cross behind, they'll be extensors. Even in your face area, if muscles cross in front of your neck, so imagine here, any muscle crossing in front, like the sternocleidomastoid, when it pulls, it's going to pull the head down, your chin down, so your chin will touch your chest, so that is flexion. The rectus abdominis, remember it lies here, right in front up here. When the rectus abdominis contracts, which is what you do when you do sit-ups, right? So it kind of pulls your thorax down like that, so it sort of scrunches up this area, so it causes flexion. All the muscles which are present on the posterior aspect, those muscles do the opposite. They cause extension. So if you remember, there was a muscle called trapezius on the back of the neck, right? That big muscle on the back, which was triangular. When both muscles are together, we call it trapezius. So that's present on the back of the neck. So when that muscle contracts, you can understand it will cause extension, okay? So for most of the body, this is the rule. But from the knee downwards, that means when you look at the knee joint and you look at the ankle joint, the rule changes. So that was because, if you remember, I told you all in fetal life, the limbs rotated in such a way that, you know, the hollow of the knee faced backwards. So for the knee and the ankle, so this is for the knee and ankle, any muscle which is crossing anterior will cause extension, and any muscle which crosses posterior will, this should read flexion, this is wrong. Any muscle that causes, that crosses posterior will cause flexion. Any muscle that crosses anterior will cause extension. Please change that. I'm going to correct that in the PowerPoint. So this is only for the lower limb, and it only involves the knee joint and the ankle and all the little joints of your foot. In the case of the ankle, we don't call it flexion and extension. Remember, dorsiflexion was the same as extension and plantar flexion was the same as flexion, okay? So this rule you have to know. So please do make sure that you have changed this to flexion. No, both for knee, from the knee downwards, for the knee, the ankle and the toes. Any muscle crossing in front will cause extension. Any muscle crossing behind the joint will cause flexion. In the case of the knee, we call it extension of knee and flexion of knee. In the case of the ankle, instead of calling it extension, we call it dorsiflexion. Flexion we call plantar flexion, right? In the toes, we say flexion of toes or extension of toes. So it's only the dorsi and plantar flexion where there's a change of name, but it still means the front, the muscles crossing in front will cause dorsiflexion. You'll see those muscles will be called extensors. Okay? So here, let's look at this example of where you don't have to memorize a muscle and its actions, but I give you something like this. Flexor digitorum profundus, so think of it, arises from the anterior aspect of the ulna, and it inserts on the distal phalanx of the medial 4 digits. So what all will it do? So try and work it on your hand. So always whenever you get muscles like this, so use your own body to kind of see from where it's going to what. So think of what joints it's crossing and then choose your answer. Okay, well, most of you got it right. Now, this is the correct answer. See, it's arising from the ulna, which means from here. It has to cross the wrist, and then it is going to go all the way to the distal phalanx. So imagine if I drew the ulna here, and this is the radius, and here are the carpal bones, and here I'm showing you and so this is, I say it's arising from here. We don't know where, could be top, bottom, but anywhere. It's going all the way up to the distal phalanx. So you can see it is crossing the wrist. It's not crossing the elbow. In order to come from the elbow, it has to arise from the humerus in order to cross the elbow. You understand? So it's crossing the wrist joint, and then it will cross all the joints of the little of all these fingers, because it's going up to the distal phalanx. So it will cross the metacarpophalangeal joints and the two interphalangeal joints. Okay? So that it will cause flexion of all those joints. Here it says it will flex the elbow. It cannot flex the elbow because it's not crossed it. It has arisen below the elbow. Okay? Here it says it will flex the wrist and the metacarpophalangeal joints. Just that. But what happens to all these little joints? Because it's going right up to the distal phalanx. It's not mentioning anything about the interphalangeal joints. So that's why this is not the correct answer. And this one tells you it will only flex the joints of the digits. But how about the wrist? It's not mentioned anything about the wrist. So therefore, that's not a choice. So that's why this is the correct answer. Followed? Okay, so this is how you should work it out. So here are pictures showing you flexion and extension. So if you look for the entire body except the knee, ankle and toes, muscles which cross in front, as you can see here, will cause flexion. Muscles which cross behind will cause extension. So you can see here it's showing you biceps lying anterior, triceps lying posterior to the elbow joint. Notice when the biceps contracts, you have flexion. When the triceps contracts, you have extension. Okay? Look at this one, from the knee downwards. The rule changes. Now when muscles cross in front of a joint, these are extensor muscles, so they will cause extension. Muscles which cross behind the knee or ankle or toes, these will be flexor muscles. So look at this. Here is the quadriceps which crosses in front of the ankle. And here is a muscle called gastrocnemius which crosses in front of the knee. And here's the gastrocnemius which crosses behind the ankle joint. Okay? We have muscles which cross in front of the ankle too. So let me just draw some muscle like this which is crossing in front of the ankle. Now look at this way. This muscle, the gastrocnemius, this one here has contracted. See what has happened. When it contracts, when this muscle contracts, it's going to pull the heel up. So when it pulls the heel up, the foot looks down like that. Can you see? As is shown over here. Can you see that? So it's causing plantar flexion. On the other hand, imagine a muscle which is present in front of the ankle here. When this muscle will contract, what will it do? It will take the foot up this way. Right? So this will be dorsiflexion. So this part is called dorsiflexion. When this goes down, this is called plantar flexion. Look at this picture it's showing you. So here the quadriceps was relaxed. It was actually stretched. Now when the quadriceps is contracting, notice it's going to straighten the knee and it causes extension of the knee. It also happens that the gastrocnemius, it acts on both joints, both on the knee and the ankle joint, because it arises from the femur and goes all the way to the calcaneus. So here you can see when the quadriceps contracts, it also causes flexion of the knee joint, and this one is relaxed. When this one contracts, it causes extension and this one relaxes. Can you see that? Okay. So let's look at a little video which shows this quite well. And I don't think there's audio in this. So look at the biceps contracting. So you can see how flexion is occurring. And there's a muscle deep it. Dallas does the same thing. And here is pectoralis. This is a pectoralis major muscle. Here it's showing you biceps because it crosses shoulder. It causes. And this is another muscle that it's talking about. So we'll Exclude that. And let's look at what happens from the knee downwards. So these are muscles on the posterior aspect of the knee. So notice when they contract how the knee flexes. So the knee is flexing, they are behind the knee joint or posterior to the knee joint. And here is a muscle which is behind the ankle joint. So when a muscle in front will contract, it will cause dorsiflexion. When this muscle contracts, notice how it's causing the foot to go down as if you stand on your toes. See that? It pulls it up, causes plantar flexion like you're standing on your toes. So here again it shows, see when it contracts, your heel goes up and your foot goes down like standing on your toes. So here are muscles, so based on them, that's how we give them names like flexor and extensor. So here you can see on the anterior aspect of the forearm, notice how all these muscles, because they cross in front of the wrist and the digits, we call them flexors. So flexor pollicis, flexor digitorum, you would have superficialis. There's another one called flexor digitorum profundus. Look at the leg up here. So on the front of the leg, because these muscles cause dorsiflexion on the anterior aspect of the leg, notice these muscles have the name extensor because extensor digitorum, extensor hallucis, because these muscles will cause dorsiflexion. These muscles here will cause dorsiflexion. And they are present on the anterior aspect of the leg. So because when they contract, what they are going to do is take the foot up like that, as if your toes are pointing towards the ceiling, right? When they shorten, that's what they are going to do. Look at these muscles on the posterior aspect of the leg and see the names, flexor hallucis longus. There's another muscle called flexor digitorum. This muscle here is called gastrocnemius, which you just saw. The names are not that important as understanding what happens. So imagine when all these muscles contract. So when it contracts, it's going to pull the heel up. So your foot now is going to look down as if you're standing on your toes, right? So these muscles will cause plantar flexion and they are seen on the posterior aspect of the leg or where your calf is, okay? So that's what they'll do. So there are muscles here called tibialis posterior. That will also do the same thing. Here, for example, you have a muscle called tibialis anterior. That means it's on the anterior aspect of the tibia. So this muscle, tibialis anterior, since it lies on the front of the ankle, what will it do? Lift it up like this, right? Dorsiflexion, okay? And here, so this was the anterior aspect of the forearm. And if you look here at the posterior aspect of the forearm, notice how all these muscles have the word extensor in front of them. Can you see? Extensor. So that's on the posterior aspect. So think of this question. A muscle called extensor carpi radialis longus. What is it going to be associated with? So two words in that should give you a hint to where you're going to find the muscle. So there are two clues in that. Okay, very good. Yes. Carpus means wrist. Radialis is for radius, which is in the forearm. And extensor, remember all the extensor muscles in the forearm were on the posterior aspect. So this would be seen on the posterior aspect. Okay, now think of this one. You've all heard of the hamstring muscles, right? And remember where the rule changes. So here I'm telling you that the hamstrings cross the hip joint posteriorly and the knee joint also posteriorly. So what would their action be? So think about it. Remember I told you from the knee onwards the rule changes, but above the knee it remains the same for everywhere in the body. So there's a little twist over here. So see what the muscle will do, what these muscles will do. Okay. Oh, well, the correct answer is extension of hip and flexion of knee. Remember, I said the rule changed from the knee downwards. Everything above the knee is the same as the rest of the body. So imagine if you look at this way. And here's the knee, and we come down, and here's the foot, okay? So here I said this muscle is crossing behind the hip joint. So let's say somewhere here it's crossing behind the hip joint, and here's the knee, and it's crossing behind the knee. And so now when it contracts, remember any muscle crossing in front of the hip will cause flexion because it's the same as the rest of the body. Any muscle crossing behind the hip will cause extension. So it's going to cause extension of the hip, right? And remember, muscles crossing in front of the knee cause extension, but muscles crossing behind the knee cause flexion. Remember that thing was opposite? So what it's going to do is it's going to kind of lift your knee this way. It's going to flex the knee this way. And your hip is also going to go back. So I don't know if I'm going to be able to draw it. It's going to do this. Can you see that? And this was the normal standing position. Can you see that, how it's going to do that? It's going to extend the hip and flex the knee. Can you see that? This is the hamstrings are the muscles which are put on stretch. When you try to touch your toes, for example, you're doing the opposite action. So when you touch your toes, what are you doing? You're flexing at the hip because you're bending down. And if you keep your knee straight, then you're extending the knee. So that's the opposite action. Many of us can't touch our toes when we have to keep our knees straight because the hamstrings are not able to stretch enough to allow you to do that. And only with practice sometimes that comes about, okay? Okay, let's see this, another question like this. The tibialis posterior arises from the posterior aspect of the tibia and inserts into the tarsal bones. So what do you think its action would be? So first think, where is it going to be? So I'm saying it's arising from the tibia. So on the posterior aspect of the tibia. So put your hand where the posterior aspect is going to be and then follow that along and think, what did I say about muscles on the posterior aspect of the leg? Okay, well, majority got it right. Yes, plantar flexion of the ankle joint. It's not going to act on the knee at all because it's arising from the tibia. It's not from the femur. And again, remember, this was exactly similar to, this was showing you this. Here, tibialis posterior would be on the posterior aspect of the tibia and coming all the way down, and I said it's going to the tarsal bone. So it has to cross the ankle joint posteriorly. So hence it would cause plantar flexion, right? I said all these calf muscles, that's what they're going to do, okay? Okay, now think of this question. Which primary group of muscles prevent your toes from dragging on the ground while walking? See, we all don't walk dragging your toes, right? You're able to lift your toes off the ground and walk. So which is the group of muscles which helps you to do that? So which is the one that helps you to lift your toes off the ground, prevent you from dragging them? So I've given you a big hint. Very good. Yes, it has to be dorsiflexors, not plantar flexors. When you plantar flex your foot, your toes actually do touch the ground. So you see, when your foot is plantar flexed like this, your toes are, you're standing on your toes, you know, on tippy toes. That's when you plantar flex. So if your plantar flexors are actually, if they are overactive, they're going to keep making you stand on your toes and they'll drag them. It's the dorsiflexors which lift the toes off the ground. They lift the toes up so that the toes are prevented from, that's why when you walk like this, right? You walk this way. So you lift your toes off the ground. So it's the the dorsiflexors. So should we stop here today? You look a bit glazed. Okay.
It's 6:30.
Yeah.
You want to keep going?
Let me see how much.
We only have.
Well, we just have a few slides left, so you know we can just do review on when we come back. So let's just finish.
Monday we have the other quizzes due tonight.
Yeah. So let's just finish this. Okay, let's finish this so that on Monday when you come back we'll do a review. Okay. So we just have a few slides. So let's look at principles of muscle actions when you're doing adduction and abduction. So here, when you look at abduction, so you think of this thing. Abduction is when you take your arm away from the side of your body, or you take your leg away, your whole lower limb away from the side of the body. So any muscle which kind of goes on the lateral side of a joint like this. So from proximal to distal on the lateral side of the joint, or here too, proximal to distal on the lateral side of the joint. Imagine when this muscle contracts, what is it going to do? It's going to pull the arm up, and this is what its contracted shortened form will be. See this? This is what its shortened form would be. So imagine the deltoid, for example, arising from here, and I pull. Can you see I'm going to pull it up like this, cause abduction. So that's the principle for abductors of the shoulder joint. What about adductors? Adduction is a movement where the arm or the limb, the lower limb is brought closer to the midline. So anything which pulls it towards the midline is going to do that. So muscles which are attached, say from medial to lateral attachment, like from the sternum here going to the humerus, or from the pubic bone going to the femur. These muscles, you can't pull the sternum towards the humerus, you can't pull the pubic towards the femur, you can do the other way around. So imagine if this muscle contracts, it's going to pull the humerus closer towards itself or pull the femur closer towards itself, and that's why they cause adduction. In the lower limb, it's an easy thing, they've got the name adductor attached to them. But in the upper limb, you can understand the pectoralis major would be a big muscle which would do that because it's from the going from medial to lateral. So when it pulls on the lateral aspect, it will pull it towards itself and it will cause adduction. This is a good video to show you that. So look at the pectoralis major. So see when it shortens, can you see how it's pulling the humerus towards itself? So it's going from medial to lateral. So when it pulls, notice it's pulling towards itself and causing adduction. So it's showing you from all aspects. Now here I want you to see the deltoid, which is going from above downwards, proximal to distal on the lateral aspect. Notice how when it shortens, it causes abduction. Can you see that? It's pulling it up, causing abduction at this point. So here are muscles, so you can see pectoralis major is an abductor. Same medius and minimus, they also attach proximally to the hip bone, distally to the femur on the lateral aspect. So these are abductors. The adductors have their names, adductor here. And in the case of the upper limb, the deltoid is the abductor and the pectoralis major is the adductor. For rotation, any muscle which crosses in front of a joint will cause medial rotation. That's very simple. Any muscle which crosses behind a joint will cause lateral rotation. So imagine a muscle crossing in front will turn it medially. Anything crossing behind will turn it laterally. Okay? So this is fairly simple. Remember, supination and pronation is a type of rotation. And remember, we said that this is in the forearm. So all these muscles, pronators and supinators, will be seen in the forearm. So here some examples of rotators. Look at these muscles which cross in front of the shoulder. They will be medial rotators. Then you have these little muscles which are crossing behind the shoulder. These muscles are called lateral rotators, okay, because they are crossing behind. Here are some relationships of the muscular system with other systems. You've done some of it. For example, the integumentary system. You remember you had the erector pylorus muscle which squeezed the glands. Then you also had blood vessels, and it was in the blood vessels, you know, when the blood vessels dilated that you had improved circulation. So you can see how that is related. Skeletal system is obvious. Muscles produce movement. They maintain bone health because the more you stress and move a joint or move bones, the more there is deposition of calcium. In the nervous system, remember, muscles need a nerve supply to it to be intact, because if the nerve is cut, they undergo what is called disuse atrophy. You remember that? I mentioned that. And also muscles in the face especially, they're inserted into the skin. So when the nerves stimulate them, you can show your emotions. So that's how it's related to the nervous system. For cardiovascular, respiratory and digestive, they affect all the muscles in these systems, and in turn these systems are responsible for giving nutrition to the muscle. Cardiovascular provides blood supply, digestive provides it nutrients, and respiratory provides it with oxygen. Endocrine, some hormones act on the musculoskeletal system. For example, growth hormone acts on it. Then parathormone and calcitonin, well, they act mainly on the skeletal system. But thyroid hormone, for example, it increases metabolism. So again, acts on the muscular system. So that's how the hormones interact. And then with the genitourinary, again, muscular system makes sure that these structures are working properly because there are certain sphincters or valves which are present. It closes them. It allows the bladder, for example, to expand, and when the bladder is full, then it contracts, and it's a muscular contraction which will push the urine out. So you can see how, again, muscles bring about action of these different organs as well. Okay?
What happens if somebody can't pee?